Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Semi-closed circuits. In semi-closed circuits, first we will see breathing circuits. Breathing circuits are the tubes which connect anesthesia machine outlet to the patient for the delivery of fresh gas flow. Breathing circuits are of three types: open circuits, semi-open circuits, and semi-closed circuits. Open circuits are obsolete. Semi-open circuits are also obsolete. Semi-closed circuit includes Mapleson circuits A to F. So Mapleson circuits are semi-closed circuits. Semi so semi-closed circuits, which are Mapleson circuits, are used clinically, whereas closed circuits are also used clinically. In anesthesia circuits, there is two-way connection is present between the patient and the anesthesia machine. So this will bring the gas towards the patient. So inspiratory gas goes to the patient and expiratory gas goes away from the patient in the to the anesthesia machine so that it can be excreted out. So first semi-closed circuit we will learn.
thank you and thank you for watching.